apart from extracurriculars and values, we also have another integral part of the MBBS curriculum, and is academics and exams. To complete our package for today, I would like to invite Dr. Lopa Mehta ma'am to speak on de-stressing examination. एक अच्छा डॉक्टर क्या होता है? Manu sir had the perfect answer. Let's see.
I am most delighted that a young, tender, undergraduate age, you decide to make a meeting of the minds and arrive at some meaning. If Dr. M.V.L.Kothari has completed 40 years, I have completed 60 years in a year. And a few perceptions cast their shadow over my existence. One is we sorely need fun and frolic in medical education. Where dancing, singing, fun should be the primary thing, because as she pointed out, when you enter the room, it is as if one more candle has been lighted and the patient feels fine. So let us all feel and study with a gusto, with an eye on Vivekanand, volleyball and Lopa, so that our upbringing is rounded. It was first university exam MBBS, and as moved across me, Vijayalakshmi from Science 75, she said, sir, I don't know anything. I said, Vijay, you spent 18 months, that was 18 months then. So she said, I know that I don't know. So I said, you are not Buddha, because if you know that you don't know, where is the great stage of knowledge? I said, Vijaya, we Gujus read only one book regularly. Make pass. But you from South would be either singing or dancing, so she said, our past 7 exams to sing, so I said, sing just now. So she sang beautiful Yaman in the University Hall, and I gave her 20 upon 20. She was happy, I was happy, but my co-examiner hesitated, Manu to Kai Kelas. Kai Kelas, 20 upon 20 they won't have it. I said, I wanted to do 21 upon 20, but university doesn't allow. But to learning check I did last night. So I said, sir, you and I have an illusion that we know the anatomy of larynx, but she's practicing the beauty of larynx. What happened? So instead of learning a muscle, she should swim, dance, so one thing is, we need to be happy within. Do what? I mean, nothing like a message, but Eric Erickson in Hippocratic Revisited, he said the golden rule of ethicality in medicine, to do unto the patient what you would be done by, and not to do unto the patient what you would not be done by. Very, very simple. And third, I was in Abu on a patient-doctor relationship, big crowd, no time left. So I go to sing, so with your permission I'll sing a song in. Yeah. मरीज is a patient. मरीज की मुस्कुराहटों पे हो निशान, मरीज का दर्द मिल सके तो ले उधार, मरीज के वास्ते तेरे दिल में प्यार, डॉक्टर उसी का नाम है. The second standard, माना डॉक्टर देखने में फकीर है. I seriously believe you should be simply dressed next to an ailing patient. You can't be foppishly dressed. You can't be ostensibly dressed. Simpler, decent, but very simple. In a conversation in New York medicine, a physician tells the patient, come on, confide to me. She says, फिर भी यारो दिल के वो अमीर है, मिटे मरीज के लिए वो जिंदगी, करे मरीज के लिए वो बंदगी, किसी को हो न हो हमें एतबार, डॉक्टर उसी का नाम है। And lastly, medical practice is understood. In fact, you have a seminar on corruption. And what is corruption? Corruption, rupture of the heart. To betray the faith that the patient is positive in you is the biggest corruption. रिश्ता है मरीज के एतबार का, जिंदा है तब इससे नाम प्यार का। We must love the patient. Albert Schweitzer, 5 years north of the equator, would take a round to hospital at night 11 o'clock, say good night to everybody, come back and get back to his work. One night he missed to go. Next day morning, 6 o'clock he goes for the round and there's the patient sitting up. So Schweitzer said, hey, did you sleep well? He said, no sir. Why? I was waiting for you to say good night. I was waiting. रिश्ता है मरीज के एतबार का, जिंदा है तब इससे नाम प्यार का, कि मर के भी मरीज को याद आएंगे, मरीज की आंसुओं में मुस्कुराएंगे, कहेगा हर मरीज मरीज से बार बार, डॉक्टर उसी का नाम है। All the best for the next 3 days.
That was beautiful. I would now like to call Lopa ma'am to speak on de-stressing examination.
Video which you saw was the last time Dr.M.V.L.Kothari spoke at this podium in August 2014. He passed away in October. He was my teacher too. And today you heard him about examination and what you should do. So I am going to take you back of how freely you can walk in the exam hall. We will make it a little more interactive as we used to have. So, what are the components involved in an examination? How many components are involved in an examination? Yes? Come on. Yes, what are the components in a given examination system? Yes, come on, you all see, I have highest regard for your intellectual capacity. So, I am sure you will tell me the answer. yourself. So tell me, what do you feel about, what are the components in an examination system? Come on. Yes?
Set of questions.
Set of questions. It's only examination process. But overall, what are the components?
Knowledge,
Yes.
confidence,
Knowledge, confidence, they belong to whom? See, I would have written with left hand, but I will fall down. So you pardon, see my back, but I am going to write with my right. Yes? Okay. Still, I'll try. Can you read it? I don't know because the board is. You have examinee? Yes? I'm sorry. I won't be able to read from that distance. You have examinee? You have process of examination. It is being evaluated by an examiner and you have the result. Right? Now let's pay attention first to examiner. I am sure all the teachers who are sitting here will pardon me because I was also examiner. I must have fitted in the same group which the current examiners would. How many factors in an examiner will affect your examination? If you are shy of saying, I will spell out. The mood of examination, examiner. Okay? That day, that particular day mood, and in general mood. If the examiner feels that he knows much more and students know nothing, you have it. So you are not responsible for your evaluation at that time because that is examiner's perception that students know nothing. Okay? If examiner had gone through a lot of traffic or her own children or his own children or somebody bothered him, then he can transfer that to you. If he or she does not know that particular topic, then he may or she may ask you in such a manner that you also get confused what is expected. That's practical part. And in theory, so many times the questions are asked are so vague that probably if you ask 10 paper setters who have set those exact question papers, their answers will differ. So do you think you should pay in terms of evaluating your own performance, your own understanding in the hands of examiners? I treat examination is a process. It's like at the red light, you have to stop and then it becomes green, you pass. So examination, if you are here, how much weightage to give to the results which are displayed on the paper? How many of you remember what marks you got in your second standard in school? And at that time, how much your parents bothered you? Other the other one came first, he got more marks or she got more marks and you got less. And how much you were disturbed at that time. So, it's only, examination is only a process. Mind you, this examiners apart, examination. If you look at the examination, do you think we can really judge the comprehension and competence of the candidate? The only person who really knows whether one has understood the subject or not is examinee. The type of questions asked in theory or in practicals are merely symbols. Sometimes I have to sort of deliberate with my co-paper setters. That here we are not to demonstrate how much we know. We have only got to find out the basic essential knowledge the student has acquired or not. So even if you have to repeat the question, because if this student also has to know anatomy of larynx, next year student also has to know anatomy of larynx, and year after year. So if you repeat basic, simple, required question, it doesn't matter. So now we come to the most important aspect, result I mentioned then, is examining you yourself. And one of the major handicap, Dr. Subbe mentioned, I put it a little differently. You saw that he said in 60s we were in the mode of saving. Whereas in 90s, and you people are born in 2000 onward, am I right? And nobody, I think all of you are born around 2002, 2003. Yes. By that time, you get everything so much aplenty that you have lost the value of what you use. See, when we were growing, I joined this institution in 63. Ballpoint pen had hardly come in. So the way now I see ballpoint pen being thrown around, we were using ink. And before that, in school, we were using slate and pen. Everything was so costly and available minimum that we valued everything. Right now, you have the problem of plenty. So you have lost the value of what you have. Because of that, you have not understood the value of getting your admission here. What I mean. How many students aspire to get admission in medical college? Along with you, how many students appeared? More than 13 lakhs? Yes. How many could come here? Now, thanks to some increase in seats, 250. In this medical hall, now we are talking about this medical hall, 250. What is that percentage? Minuscule? Don't you think every day you should be grateful? Tell me honestly, how many days you feel nice when you wake up that you are going to be able to study where you wanted to study? Next, you are studying a human being. You yourself also are a human being. And this is where I want to bring out how you need to change your perspective on your study. MCQs cannot judge your learning. So examination in MCQ, even if you got 100% marks and you are here, thanks to the coaching classes, now you fold that pattern of learning, your own self start correlating with your subjects. I talked first about anatomy because that's what I taught for 33 years. In anatomy, I have been begging of students after even I retired, don't read the books which are 1, 2, 3, 4, 5. Anatomy is a subject which you learn. It's a photography. If you have seen me, can you forget me? But if you read a book that so and so has this much height, this much weight, this is the complexion, this is the length of nose, this is face, how this many features, how many points to remember, and still can you really make out? So as anatomy is photographic memory, I am telling you, medicine itself is photographic memory. If you will see 10 patients with so-called same level of diagnosis, they will not be same. That will be the technical aspect, symptoms and sign-wise. And at the same time, the body language, if you are focusing attention on something else that patient knows, you are not with him and he gets put off. So both these aspects you can only learn what Dr. Sukre just highlighted, how you cultivate your values. And pardon me for saying this, I am cautioning you, don't get carried away by so-called guidance of your peers. I told number of students, don't read 1, 2, 3, 4, 5 type of books. But still, because the seniors told them, they trusted them more. So the beauty of internal year or middle year, they learned through 1, 2, 3, 4, 5 rather than exactly visualizing which they could have. And peers are greatly responsible because they feel, oh, they have read, they have passed, so we are sure that we will pass. And second most disastrous thing which we are watching now is that your peers tell you, no need of going for posting. They make you sit. Each patient is a live textbook. It's not that Dr. Manatkar, for example, can spare so much time in giving you didactic teaching. It's not required. You have God-given beautiful 5 senses. I am sure all of you have more than 100 IQ. You all have wonderful language skill. I think most of you know, articulate yourself very well. So you don't need those kind of things. What you need is eliminate from your seniors if they have told you not to go for posting, not to go for words. Give the attendance and run away from behind. These are something disastrous messages. This has come only after the coaching classes scenario has come in picture. If you are giving, you have come to learn, teacher as much learns talking to students. So if you encourage the teacher, teacher will be encouraged. And it's not always the didactic teaching. You learn from sisters, you learn from ward boys, you learn from relatives, you learn from, of course, patients first. Then you see how those residents handle patients. You decide what you want to do, what you want to do. And most important, this I am telling you, being a warden of ladies hostel for 33 years, I have seen how students psych out each other. they psych out in such a manner that they say that, oh, we are not reading, we are not doing anything, or they present some difficult things saying that this is going to be asked and make nervous each other. Here, let me make it very clear. University does not prevent everybody to score good marks. Everybody can score good marks. So instead of secretly learning, secret clinic and secret things, share, share and share. More you will share, more you will learn. Every time I have taught a subject, I have learned much more. So if you share, so if you stop looking at your classmates as your competitors and look at each other as friends, entire vibration will change. All, if you now see, we have, I said 63 batch. So we now reunion, now we have a WhatsApp group, everybody says, oh, how nice it is to have friends and all. I'm not so sure whether at that time everybody was so friendly, but now everybody is very friendly. So if you can change your perspective and enrich yourself of this 5.5 years here by sharing, not only but sharing and caring for each other. If all of you are prepared, even one and somebody, and talk amongst yourself, if you deliberate, you will know much more. And that itself will enrich. And this is where I say now that when you are learning anatomy and physiology, most of you, if you are seeing it yourself, that whatever muscles I learned, in which movement of my body I have put them in practice. If you see in yourself, most of you start using lift. Let me tell you, if you won't have to go for gym, if you just every day climb those staircases which you are expected to do. And then, at that time, if you can recall how much of Krebs cycle, production of lactic acid, everything goes in your body. This is called assimilation, synthesis of your subject. And once you have vision, you don't need. If you have vision, you don't need revision. You don't have to study your book from first page to last page. That's the last thing you have to do. Become an inquirer with each topic. You have to have your own set of questions. Become an active learner. You know Kipling's 6 questions? Yes. He says they're my 6 best friends. Who, what, whom, where, when, and most important, why. If you will satisfy, don't postpone your understanding. Most of you feel so secure, oh, I got now, of course I can say. At our times we didn't have Xeroxing facility. And now, of course, I see everybody, student just clicking on mobile, whatever is given. So you feel secure, oh, I have with me. But it is only outside you. It's not with you. Maybe if you satisfy yourself, why am I learning this topic? What is its relevance in my day-to-day being? Then what it can go wrong? What will go in anatomy, for anatomy wrong, pathology will be very enjoyable. physiology and biochemistry will become so relevant if you apply them in pharmacology. And of course, when you will synthesize all this together, Dr. Natkar will be very happy to have you as his students. Those who are interested in knowing everything about a patient who is a person first, and he has incidentally become a patient, and it's your responsibility that patient take disappears very fast and it continues to remain a person. So active learning is your responsibility. Don't blame your teachers that they are not teaching you. Doesn't matter, you now all learn by Google, whether they teach or not. Your subject is there, words are there. In fact, that is where I said you have to be thankful that you are at St. G.S. Medical College and KM Hospital, where you have more number of patients than you can handle. So all types of diseases you will be able to see. We get students from abroad only to see clinical material, as they use the term. Please don't use the term material, patients. Okay? So, once you are clear, if the whole class, you know those two anecdotes which I love. One American, as usual, me myself, went with a booty to Africa, and then he said that, call those tribal children that if you, whosoever reaches fast that point, will be given this award. And what they all did, they all had hands together, they ran together, and they said, how can one enjoy and others be just looking at us? We all would like to share. And another was handicap race, paraplegic. Then while they were running, not paraplegic, but they were handicapped. And while they were running, one person fell down. So the others noticed that he has fallen down. They went back, picked him up, everybody held their hand together and they ran together. Because they could not see somebody in distress being left behind and you reaching ahead. So you as a class become friends to each other, become active learner. In fact, you know how the implant came for the lens implant? One of the medical students asked the professor, when he saw that he has removed the degouged the lens, so now will you be replacing it with another implant? And that's how it came. So if you are not preoccupied with peers comparison, as I say, don't live in the world of relativity. किसका हाइट अच्छा है, किसका वेट अच्छा है, किसका कम्प्लेक्शन अच्छा है, किसने अच्छा ड्रेस पहना है, मेरे पास ऐसा होना चाहिए, ये सब is world of relativity, which is all dependent on outside factors. Inside factor is sun has come on correct time, wonderful breeze is flowing, water is there, food is there, everything is fine. What more do you need? So with that sense of contentment, you will be able to so much take care of yourself and you will reach out. And once you learn, all of you learn together, active learning of why, where, when, what, how, of everything. Learn, develop that attitude. Don't underestimate your capacity. Do you think only Western mind is capable of earning? By the way, I am not impressed by Nobel Prize because Nobel Prizes are only given for those things which has harmed mankind. But what I mean that changes which can change the world for the better. Each one of you have potential, only thing you have to explore. So don't get carried away by this MCQ type of exam. It's for a while, you have to do it. If you learn properly, if you have proper vision, you will answer it properly. So, examination, you should be having upper hand over examination rather than you examination generating so much fear in you that you lose your smile, you lose your health, you lose everything. So I would like you that don't pay attention to results. Results are outside you. Pattern of exam, mood of examiner, computer mistakes, and whatnot. But be happy. Each one of you is a unique creation of this Creator. Respect the wealth given by Creator to you. As I say, the only time I am very miser is spending time. Each moment when I do not spend with happiness, contentness and all, I have lost. And every time, every moment I spend with happiness, contentment, feeling nice. Feeling nice is an internal factor. Nobody else can give you. So then I have lived that moment. So out of all these years, whatever time I have felt nice, I have led. Otherwise, even if you live 100 plus years, but if you have been cribbing, you have gone. So I have been feeling so much about this. So we have this law, and I said, let me take this opportunity to tell you, don't get bogged down by, sorry, I'm going to name some authors like Chaurasia. Respect your intelligence. Create that wonderful link, assimilation in your head. Share with each other. Continue with this. No examiner can, because he has to fail somebody, he will fail. No, it doesn't happen that way. And mind you, after saying so much about examiners, majority of examiners come not to fail. They want to pass. And when they give some hint, take it in a positive manner and pick up from them in case you are negative here there. So there is a pleasant side of examiners also. As you say, saw Dr. Kothari say, just sing and give. So all examiners, majority of examiners, you have to have some exception somewhere. And all these experiences also enrich you. Don't worry. I also once upon a time dread fear of examination. And all this now what I am telling you has evolved out of experiencing, maturing, then seeing what is happening. And that's why I thought let me share with you. Can I request you to give me some, or question me something whereby you want me to answer before we go to the next? Feel free. I am not going to be your examiner anyway. So students are worried about हमारे internal examiner होंगे, postgraduate exam होंगे, ये हमारा क्या हो? They are scared, but here we don't have to worry. Yes? Yes, Hema, you want to say something? Question something? Sure? Now let me take feedback. This feedback I don't immediately want. But somewhere you reflect over what I want to say. And as and when you feel that something changed in you, let me know. You know where I sit, so you can just mention. Okay? Thank you very much. This is one area I was told foundation course has not dealt with. Am I right? How to enter? Go for this. And that's why. Yes? Am I right? Okay, so in case, if anything, any of your perspective has changed after reflecting over all this, give me that feedback because then I will also know whether my line of thinking somewhere registers. Okay? Thank you.